And we begin tonight in Sumter as the Tuomey Hospital there is making another expansion to their services. Last month, we told you about a $15 million expansion coming to the hospital's emergency department, but now they're getting more space to take care of the hearts in the community. News 19's Peyton Lewis is in studio tonight. She is joining us now with those details. Peyton?
JR, according to CDC data, 309 people in Sumter died of heart disease in 2020. Doctors say for many of these people, delayed care and a lack of access likely contributed to their heart problems. Now, Tuomey Hospital is hoping to give people care that's a little bit closer to home. The old saying goes that in any emergency situation, seconds count, especially when it comes to matters of the heart. And Sumter doctors like Francis Gilliam say a few minutes versus an hour can be life-saving.
They don't have to go out of town, so this becomes an easier access for them. We become something that is not a 3-hour trip to go to Columbia, get seen, and come back and then have to go back. You can do it by 10 minutes down the road.
If a person needs emergency care that Tuomey Hospital is unable to provide, the hospital says your option is an hour-long ambulance ride to Prisma Health in Columbia, an almost 2-hour drive to Charleston, or a 15-minute helicopter ride. But now, with the opening of a new cardiology center, the hospital is hoping to keep care closer to home.
We can do regular heart cardiac catheterizations. We can do pacemakers, defibrillators, all those devices. We can actually do echocardiograms and do all types of non-invasive tests.
Tuomey Hospital will have 4 cardiologists working in their new heart center that has 21 exam rooms to see several patients at once. Although you can go to the heart center for everything from a new pacemaker to an EKG, Tuomey is still waiting on the state to grant them a certificate of need to be able to perform emergency angioplasty, which allows doctors to open a clogged artery. Speaker of the House Merle Smith attended the opening of the cardiology center and says he and other representatives in the state are working to change the certificate of need process.
DHEC has to give you permission that you would be able to do that. That's been an issue that we've debated over the years in the General Assembly, certificate of need and the reform. And I'm very optimistic this year that we're going to see reform on the certificate of need so that we can expand access to rural areas.
Right now, according to Prisma Health, South Carolina ranks 16th highest in the nation for heart disease. With the implementation of care closer to home, Tuomey CEO Joe DiPaolo says only time will tell.
We can only wait and see, but certainly, my only advice to people is if you feel a tinge, if you feel a twinge, if you don't know what's happening, now we have a full cadre of people here to help regardless, 24/7.
And Tuomey Hospital says in addition to the expansion of their cardiology department, they're also looking forward to their emergency department expansion. They spoke with us about that in October and said that expansion will take a little longer than the heart center, which only took about 9 months. The emergency department will take more than a year. Reporting live in studio, Peyton Lewis, News 19 WLTX.